Today I want to go through the difficulties from patient side and also from the practice side which we face regarding colon cancer screening. Is getting more and more prevalent. Every year more than 100,000 people are diagnosed and dying with colon cancer. The screening tests are very effective, but the acceptability rate by the patients is very poor. In this video, my goal is to provide you with evidence-based information why you should get it, how you could risk stratify yourself, like which bucket you fall, then how to prepare yourself, what to do during procedure, how you recover, and what could be the possible red flag signs or complications. If I could explain all these things in this video, I think I will convince you that you should get screening colonoscopy. Benefits of colon cancer screening. Colon cancer is increasing in incidence and prevalence. We had a handle on it due to better screening, but with new data coming in, younger adults less than 50, they have increasing rate of colon cancer detection, and we are finding it in that population when it is already metastatic. The dietary pattern has changed, our social norms have changed, and that has led to more and more people being exposed to processed foods, no fiber, leading to increase in colon cancer incidence and prevalence. First of all, everybody should get colonoscopy, but you could risk stratify yourself average risk, moderate risk, and high risk. Who is at average risk? Everybody above the age of 45, according to American Cancer Society guidelines, is considered average risk. If you get a colonoscopy and it's absolutely clean, there was no polyps, no other red flag signs, you will need colonoscopy every 10 years. Second category is intermediate or moderate risk are the one who have some risk factors, chronic constipation, weight loss, family history, or they had colonoscopy in the past, they have polyps, or you have conditions which put you at high risk to develop colon cancer. Those include ulcerative colitis, Crohn's disease, and any other inflammatory bowel disease. They all will put you at a more than average category. Very high risk are the one who already have colon cancer and they are getting a surveillance colonoscopy. So based on that, most of us will fall an average category. Few of us who had polyps in the past will fall in the category of intermediate. Very few hopefully are a very high risk group. If we diagnose colon cancer on a screening test, your chances of curing it is 90 to 95%. Moment the cancer is widespread, stage 3 and 4, your prognosis falls into 30s and 13s. And this is a major issue. Early screening saves lives. That is the core out of this video. Since we have considered who should get it, let's go over why people are so reluctant to have colon cancer screening. Biggest complaint people have for colonoscopy or colon cancer screening is being the invasive nature of it. You have to be prepped, you have to be disciplined 3-4 days prior to the procedures, but it is not that big of a deal. The basis of preparation is you want to have a clean colon so that if you go through the hassle of getting colonoscopy, your gastroenterologist can look inside your colon and can very reliably tell you, are there any polyps, any tumors, or anything going on. Preparation for colonoscopy. We have already established the goal is to have a clean colon. What makes the bulk in the colon is fiber. So 3 days prior to your scheduled colonoscopy, you need to go on low residual diet which is low in fiber, meaning no whole wheats, no legumes, no vegetables. You go to simple food which is low in residue. That way the load, and hopefully you are having a BMs and you are decreasing the load in your colon. And then day prior to your colonoscopy, your gastroenterologist will prescribe you laxatives. And there are two kinds of laxatives. One is the dreaded Go Lightly, which we have to drink in a large volume of 3 to 4 liters to induce diarrhea so that our colon is cleaned. Second class is the sodium phosphate based preps, which are smaller in volume, and they also do the cleaning of your colon. Whether you're taking phosphate based or you're taking newer ones or you're taking the Go Lightly, New Lightly, they all rely on a mechanism that they pull water in your colon and they induce osmotic diarrhea because the volume in the gut increases and you purge out and you clean your colon. It is difficult experience for a day, but look at the bright side. If the test is completely normal, you will be clean for next 10 years and you could live with certainty that you are not going to develop cancer. Day prior to the colonoscopy, some gastroenterologists prefer that they give you another dose of laxatives about 6 to 8 hours before the procedure. Whatever has not swiped through before, the last dose will do. They also recommend that anything which is colored, especially red, purple, and yellow, they do not want you to be consuming it. If you're going to have a procedure tomorrow, today, you will not have any solid food. It will be all clear liquids without any residues. During prep, you must keep yourself hydrated. Prep, which is phosphate based, they go through the kidneys. If you have a kidney problem, heart problem, you should avoid sodium phosphate based preps. Your gastroenterologist will go through detailed history and they will prescribe you for appropriate laxative. Do not use your discretion, listen to the professionals, and they will keep you safe during this procedure. After you have prepped, the intention is that you had good BMs, your colon is clean, now you are ready for the procedure. Before you go for the procedure, if you didn't had a good result, meaning you didn't had a good BM, you make sure you let the gastroenterologist know. If you didn't had enough BMs, you don't feel clear, you must let them know. They always provide you phone number. You could tell them that you are not ready for the procedure. Further, small irritation around the anal verge can happen. Use some lubricant and make sure you are near toilet and keep yourself hydrated. On the day of the procedure, there are few things you must know. Because you will be given anesthesia, you need a chaperone who will drive you to the procedure and after the procedure. Many endoscopy suites will cancel your procedure if you don't have somebody. When you reach your endoscopy suite, whether it's in the hospital or freestanding, you will go to the reception and they will confirm your insurance. Hopefully they have gotten all the authorizations before the procedure, because nothing could be worse than that you have gone through prep and somebody tells you you can't have the procedure. So make sure day prior to that you talk to the endoscopy suite and ensure all the referrals, all the formalities are done. After you go through the reception and registration, you will go to the area where nurses will take your history again, check your allergies, medications and everything. They want to make sure you are safe. Followed by gastroenterologist will come in, introduce, and then anesthesiologist will come in. They will assess you again and they will take you to endoscopy suite. They will give you medicine, conscious sedation, and you will be knocked out, and that's probably the best sleep you will ever had. When you wake up, your procedure is done. During procedure, gastroenterologist will come in. After lubricating, scope will be inserted. Hopefully you are clean. They are going through different parts of the colon. They will search for polyps or anything they see. Good part is if they find anything during procedure, they could biopsy it. If there are polyps, they could cut it, they could cauterize it. It's a very, very safe procedure. While they are retracting, they take time to take the scope out. These days, scopes are very sophisticated. Artificial intelligence is getting embedded into these scopes. Proper lighting system is introduced, and a lot of other technology is being built in these scopes. You will be brought back to the recovery area. In the recovery area, you will rest for some time. When you are back to your normal self, the nurse will come in. She will give you instruction during colonoscopy to inflate your colon. They use carbon dioxide, so you could expect a bit of bloating and you will pass gas. And then if you happen to have some polyps, they are taking it out, you may feel a little bit of discomfort, occasionally minimal rectal bleeding. What are the red flag signs? If you are having significant discomfort, that could be a sign of perforation, or when they cut the polyps, bleeding. So make sure you let them know if there is a severe pain or significant bleeding. Gastroenterologists are very cognizant of that and they respond very well. In my practice, thank God, only a couple of times in my 28 years, my patient have to call, but they always come through for you. God forbid, if any complication happen, is 100% treatable, reversible, and they are very good with taking care of that. After your procedure, most of the time is routine. Plan to be off the day of the procedure. Take it easy. You may have some cramps. Then slowly you could introduce your diet, and your mentation will start improving. You will start getting better, and then eventually you will be back to normal. After the procedure, if there was no biopsy, no polyp was taken out, you are done and you could resume your life. And then usually they will give you printed pictures of your inside colonoscopy, the papers, and you could see it. If they have taken polyp, they usually take the pictures and give it to you. Bring it to your primary care office. We will get the records, and then if you had a biopsy, it takes about 2 to 3 weeks, sometimes 1 week, depending on which institution you are working or where you had the endoscopy. The biopsy report will come in and they will discuss with you, and hopefully everything is good, and if there is any abnormality, they will talk to you. This basically is the simplified version of what happened before colonoscopy, why you should get colonoscopy, how to prep, how to go for a procedure, what happened during procedure, what are the red flag signs. I think my idea was to introduce you to this procedure. That way you are not just scrambling. Please like, share and subscribe to my channel Colonos MD. I will answer any of your questions if you have. I hope to see you in one of next videos. Thank you very much. Please do comment, because that helps me navigate and create new content which is more relevant to your needs. I hope this was informational. Thank you.